Hi, I'm Dr. Chris Heimlich, DC. I've been practicing in Scottsdale, Arizona since 1995. I consult over 500 doctors across the country. My postgraduate studies and continuing education is in functional neurology, blood chemistry, autoimmune disorders, functional endocrinology. I do my postgraduate studies through several different places, including the Carrick Institute, Johns Hopkins, and Harvard. You can check out my website at AskDrHeimlich.com. And today I'm here to talk to you about autoimmune conditions. An autoimmune condition is a condition when your immune system is attacking a part of your body. What is this? Well, you have things like ankylosing spine and rheumatoid arthritis, where it attacks your joints. Psoriasis, where it attacks the moisture-producing glands. Lupus attacks the skin, kidneys, joints, and other organs. Scleroderma attacks the connective tissue. You've got Hashimoto's thyroiditis. It attacks the thyroid. You've got Graves. You've got MS, attacks the brain and spinal cord. There's celiac disease, which attacks the intestinal tract. Adrenal glands get attacked whenever you have Addison's. You've got pernicious anemia, which attacks the red blood cells, and B12 has to do with that. Myasthenia gravis, attacking the muscles. You've got Raynaud's, which attacks the joints. Type 1 diabetes, and it attacks the pancreas. So there's a lot of different immune conditions. And what I'm here to tell you is that what makes us different than pretty much every doctor you've probably been to is that we treat you metabolically and neurologically. And the reason you're watching this video is you or a loved one is suffering from an autoimmune problem. Your immune system is attacking a particular part of your body. So I want to tell you is that we don't lose any stone unturned when it comes to find out the exact cause of the condition. Now, how do you treat an autoimmune condition successfully? Well, I treat them metabolically and neurologically. They go hand in hand. You have to do it together. So where do we start? On the metabolic side, you start with the complete blood panel. What I mean by this is a lot of people will come into me and they will have their lab tests and say, well, my labs all show that it's all normal. Maybe, maybe not. What happens whenever you have normal lab ranges from the lab, it comes in, they're pretty broad, they're pretty wide. We look at the narrow, the functional ones. What we can do is we can take TSH, which is thyroid stimulating hormone, for example, and the lab values on those are anywhere from 0.5 to 5.0. Now, if we take a functional level of that, it's 1.8 to 3.0. So it's much narrower. And we want to look at those narrow ones because we want to look at you functionally to see what's wrong. Because you can't be having this problem and have normal blood labs. It just doesn't work that way. So we do a complete blood chemistry. CBC was autodifferential, looking at red and white blood cells. We're going to look at the T3, T4, total T4, TSH. We're going to look at the lipid panel. We're going to look at these lab ranges and be as thorough as possible. This way we can assess your thyroid, your adrenal, your liver, your kidneys, your white blood cells, red blood cells, gut function, all those with those tests. And if you have an autoimmune condition, then we need to run these tests. We need to run sensitivity tests because if you're sensitive to gluten, milk, soy, egg, or yeast, it's affecting your immune condition. What is gluten? Wheat, rye, barley. So we need to run the test. We don't know until we run it. What are some of the symptoms if you have those sensitivities? We can have chronic pain, you can have fatigue, indigestion, bloating, after eating, frequent loose bowel movements, constipation, pain in the arms or legs, and we don't know until we test. We also want to look at your adrenal glands. Those sit right on top of your kidneys. And the best way to measure this is with a spit test, a salivary test. We're looking at cortisol levels at 8 in the morning, noon, 4 in the afternoon, and 10 o'clock at night. If your immune system is attacking part of your body, we've got to check this. So there's two parts to your immune system, and it's complicated, I realize, but you have Th1 and Th2. They should work together. Th1 has certain markers. It's called TNF-alpha and interleukin-2. If those are high, then you're Th1 dominant. Th2 has markers called interleukin-4 and interleukin-10. If one or both of those are high, then you're Th2 dominant. Th1 cells are T cells. They go in and attack the invaders of the body, and then they clean up afterwards. There's helper cells, suppressor, natural killer, regulatory, macrophages. It gets pretty complicated. Th2 are the B cells, and they make antibodies. They tell the T cells what to do. So if you're Th1 or Th2 dominant, we want to find what's causing the dominance. It could be active antigen or dysregulation. Those are the two choices. We need to do some testing to find out. An active antigen could be caused by a parasite, bacteria, virus, mold, yeast, fungi, protozoa. Food sensitivities, remember those? Chemicals, heavy metals. That's indicator for active antigen, and the cause of patients of normal dominance is called a CD4 CD8 ratio. If it's 2.5 or above, then you're anti-antigen. If you're 1.2 or below, then it's a dysregulation, and you treat those totally different. They get treated totally different. H. pylori is a bacteria that could cause an active antigen as well. You could have a problem with that leaky gut syndrome, and leaky gut is where you have an altered and damaged bowel lining. Think of your bowels as you're supposed to have things get in and out, just like screens on your windows let air in and out. But it's supposed to keep the bugs out. If those screens are torn, the bugs get in. If you've got an autoimmune condition, we might look at your neurotransmitters, your hormone panel. We're going to look at inflammation in your C-reactive protein, homocysteine levels. By specific metabolic testing, we're going to know how to treat you nutritionally. We also use glutathione because it's a mother lode of antioxidants. But you can't take that orally, you have to take it transdermally because that's the best way, one of the best ways to get it in your system. Again, right hand, left hand. What are we going to do for you neurologically? Well, your brain needs two things to survive, fuel and activation. Fuel is oxygen and glucose. Activation comes with other different types of stimulations. We'll talk about that. We have to do a complete neurological evaluation on you first to see if you have any type of disconnection in the brain, or functioning disconnection syndrome. Once we determine that, then we're going to know what type of modalities to use to help you get back to where you need to be. We can use vibration. It stimulates the back part of your spinal cord. It travels up into the cerebellum to the brain. We may use auditory stimulation, listen to sounds in certain ears. We may use olfactory stimulation. Different smells affect the brain differently. We may use visual stimulation, a tool called interactive metronome. There's lots of different tools that we can use, more than I have time to explain in this 10 minutes. So next what we're going to do is get those modalities and figure out what we need to do with you. Now, I don't care what your autoimmune condition is called. We need to get to the bottom of it and find out what the problem, the root cause is of it. So I want you to ask yourself the question, how's your autoimmune condition affected your job, your relationships, your family, your finances? How's it affected your life? What's it cost you in time and money, happiness, sleep? And where do you picture yourself in the next 1 to 5 years if it isn't corrected? And finally, what's it worth to you? And the reason I ask this is because some autoimmune patients come in, and other patients as well, and if they don't follow our recommendations, then they don't get the optimal results. We don't get you to maximal recovery. And I know it sounds harsh, but if you're one of those type of people, we don't want you in the clinic. We don't want you to waste your time and money and our time. I'm not trying to be rude or trying to be mean. I'm just trying to let you know that I take things that we treat in here very seriously. Now, what do we do next? Well, you need to call our clinic at 480-991-9355. Visit our website, askdrhelmick.com. Request a patient packet. And we'll send you out a DVD on the autoimmune condition that's going to explain a little bit more in depth of what's going on, give you some paperwork to fill out, and they can send it in. This is Dr. Chris Heimlich saying thank you for watching this video. I look forward to seeing you in the future. Have a great day.